Good morning, and thank you for joining us for this episode of SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Really excited today to bring on one of our brand new partners. We have Dr. William Nields with us this morning. How are you?
I'm good. Thanks for having me, Amanda.
Wonderful. Yes, thank you so much. I know you're a busy man. I appreciate you taking time out of your morning to tell us a little bit about yourself and what it is that you do, because you are in a very unique field. You know, all of us have been touched by Alzheimer's and dementia at some point in our lives, or we know someone that has. So what is the history of what you do and the background, and what inspired you to get started, with this unique field?
Well, that depends on how far I want to go back. You know, I'm a primary care doctor, and I have always been interested in finding the root cause of problems and trying to alleviate problems at that root cause and allow people to obtain their optimal health and I guess not be spending all their time and money in medical care. And so really that all started with looking at things like diabetes reversal, coronary artery disease reversal, and other things, using lifestyle modalities largely, which are quite powerful. But I had patients with cognitive decline, and while those lifestyle modalities can be very helpful to prevent them, once cognitive decline or sort of the brain is starting to show dementia, not function properly, I didn't have anything in my toolkit to reverse that problem. And so I was looking for answers, and I came across the work of Bredesen. I heard a lecture from him that was astounding, that he had taken a similar approach where he was looking at the root driving biological causes of Alzheimer's disease, and he developed a protocol that could actually reverse that process. He had success treating patients and had some people go from dementia back to functional, which is a medical miracle. So I went and got trained in his protocol, started to apply his protocol in my practice, and the impact on patients' lives was tremendous and very gratifying.
Yeah, absolutely. And that's really where, Cognitive Health Centers was born, I'm guessing. So tell us a little bit about the center. Obviously, you practice based on what you learned from his protocol, but tell us a little bit about what your day-to-day looks like there at the health center.
So in a busy primary care office, it's a little bit difficult to apply this protocol, which is pretty comprehensive. So it became clear to people involved that we needed to have sort of a specialized center that was focused on this. And while there is still some overlap with primary care, because so much of it, there's just a lot of overlap there. A lot of what you're doing is primary care. Our center focuses largely, the purpose of the visit is to focus the care on cognitive care. So we see patients for many different reasons. We do screening for patients that just want to know, am I at risk, or how's my brain health doing? Are there things I can do to prevent cognitive decline, to slow that aging process down? And all the way to people that have dementia and are trying everything they can to reverse that process. And we work a lot with families in those patients. So we screen the patients, we find we do a very deep dive into the causes of, on a biological basis, what's causing the brain cells not to function, what's causing the brain not to function. And then we start addressing those problems, we prioritize them. And we found through the work of Bredesen, I should say, that there are many subtypes of Alzheimer's. And so we subcategorize them and develop personalized treatment plans.
Yes. Yeah. So for those out there that maybe have gotten the DNA test done and they found that they have like the gene for late onset Alzheimer's or any of those cognitive issues, what are some of the advice that you would give to folks like that? Because I'm sure diet has a lot to do with it, but is there any other advice that you would give for folks that maybe have the potential genetically, family history and so on and so forth. What advice would you give to those folks?
So let me clarify the genetics first. The most common gene that's associated with Alzheimer's is the ApoE gene. And if you have an ApoE4 allele, that puts you at a higher risk. And it's not that that's the strongest gene, but it's the most common one. So that if you have 2 copies of that gene, you have a 65% or so chance of developing Alzheimer's. That gene creates a lot of problems in the way our brain functions as far as protective mechanisms and as far as inflammatory mechanisms. So we know specific things for that particular gene that need to be done. There are other genes, TOM40 and others, that can cause the brain to be in a hyperinflammatory state. So we might offer different advice to some extent, depending on a person's genetic profile. However, in general, you're correct. The diet is extremely important. When Alzheimer's begins, which is the process begins 20 years before you even see symptoms. Okay. But as it develops, the brain loses the ability to uptake glucose. And so we see this on FDG PET scans where parts of the brain are not using glucose, and that's the fuel source of the brain. So if you're not using the glucose, your car is running on empty. So we can switch the fuel source by getting people into ketosis. And so that's a I guess a metabolic trick that we use to use the body's backup fuel burning system. And that can give the brain the fuel it needs to function. And people often will feel a big pep. The brain will really kick in when that happens. We don't use any ketotic diet. It's a very healthy ketotic diet, largely nutrient rich, very plant-based. So there's a lot of training that goes along with that part of it. But also exercise. Exercise is a foundational principle. Does a lot of really important things in the brain to protect it from aging. We have a lot of attention and time spent on sleep, making sure people are oxygenating well at night. That's really important. And then there's oral health. So if you have inflamed gums and a lot of certain type of bacteria in the mouth, that can create problems in the brain. Scientists have found, just as they did with heart attack victims, oral bacteria or bacteria from the mouth in plaques of a ruptured heart attack, they find oral bacteria in the plaques in the brain. And they've even worked out how that happens. So those are foundational things. Then we get into a lot more specific issues that have to do with support for the brain, like hormones. We look a lot at toxins. People often have toxic exposure, which is harming the brain. And so we use different modalities to deal with that. And then the diet, exercise, sleep, a lot of that addresses many of the inflammatory things. But that's essentially sort of an outline.
Yeah, no, that's wonderful. I've always, wondered a little bit about this since all the genetic testing came out and people are checking their DNA to see, what they may be at risk for. And I know that's a biggie. I know, like macular degeneration, things of that nature too. And I've always really, truly believed that diet is probably linked to, not necessarily a cure, but maybe a preventative measure. So I think that what you had to say was fantastic. I'm really impressed. So people are, going to wonder what your health center is about and when they can, how they can come and see you. Does insurance cover it? Things of that nature. So do you want to talk a little bit about, what the process is to get started? Is it covered by insurance? Is it private pay? What are some of the things that our viewers and our readers need to know about your center?
Well, many of the services are covered by Medicare. So we're able to bill Medicare, which helps defray the cost, but the intense time and effort that it takes to do this work, we do have a fee in addition to that. So we have monthly programs where people sign up monthly to pay for those extra services. And it works out pretty well. There can be additional costs with different modalities depending on the individual and what we find. And so people call the office and they find the best program. If they're looking for a screening program, we have a track for that. It's we do all the testing, the analysis, and then we summarize those findings with the patient and give them, this is sort of a treatment plan that we would recommend that you undergo. Then they can take that and go to use it however they want, right? Or if they want us to help manage that treatment plan, then they can go further with us.
No, that's fantastic. I think a lot of folks are going to be interested in learning more. Now, right now, your Sarasota location, where are you located, and are you considering expansion? And I'm sure because of how unique your services are, people are coming from other areas to visit with you and get that treatment plan. So tell us a little bit about how we can get in touch with you, and if somebody is out of town, is there a possibility you're going to be coming to a town near them? Those types of questions.
Yeah, so we have a clinic in Sarasota and a clinic in Jacksonville, Florida, and there's a lot of opportunities, and we are expanding. So I'm not quite at liberty to say where the next clinic will be, but there will be more clinics coming. Right now, we see people from around the country, so we do a mix of in-person and telehealth. Okay. So people come maybe for a time, and then they're able to go home. We have people all over the country that we do telehealth with. And
sure. Yeah, once you get that initial consultation done and you've got all of their labs, it's probably much easier to do things, remotely. So that's wonderful. Well, Dr. Nields, thank you so much for your time this morning. It's been a pleasure getting to know you. I'm sure our readers and our viewers will have questions, and you can click the chat above for more information. Appreciate your time.